Hello everyone, I am Dr. Samrat Jankar, a board certified colorectal surgeon and fistula expert. Today we are going to talk on most important yet overlooked topic. Can chronic recurrent fistula become a cancerous? Although I have to put first that the fistula becoming cancer is very rare. In last 15 years of my experience, I have seen only 3 patients. Although my monthly I can expect that I operate on an average 20-25 cases, but I have seen only 3 cases. Means incidence is rare. The particular this topic want to discuss because we have to have the knowledge about this also. So before diving into the topic, we will briefly know about the fistula. Fistula is nothing but abnormal tunnel which is connecting inside the anal canal to outside, and because of chronic recurrent pus discharge and infection and inflammation, there is one of the potential cause it can become the cancer is known hypothesis. So let's understand more about this in this video. If there is a question, can chronic recurrent fistula-in-Ano become cancer? Obviously answer is yes. But I remind you, it's a very rare condition to see, and most of the colorectal see a few cases across their whole career, surgical career. The incidence what has been noted in the literature is 0.3 to 0.5%, even it is less than 1%. And this is usually associated with chronic, recurrent, untreated, repeated inflammation having a fistula, usually associated with Crohn's, or patient is having HPV infection. So this kind of cancer developed in fistula are known as fistula associated anorectal cancers. The fistula associated anorectal cancer risk factor are known to be a long term means more than 10 years, a known fistula, undiagnosed fistula, untreated fistula, or recurrent fistulas associated with a person is smoker, older age group, particularly in the female, and having known history of HPV infection or Crohn's disease or chronic smoker are the risk factor for forming the fistula associated anorectal cancers. Fistula associated anorectal cancer are mainly two types. It can be adenocarcinoma, where the cancer is starting from the rectum mucosa going into the fistula tract presenting as a cancer, or it can be squamous, where the recurrent inflammation or HPV infection presenting as a cancer. The diagnosing of the fistula cancer based on the symptom usually tricky and difficult for any surgeon, but usually the warning symptom or red flag symptom in fistula think that it can be a cancer are a new onset of worsening of fistula symptom. There might be a older age, weight loss, loss of appetite. There might be a mass feeling or unusual discharge kind of mucin kind of material is coming. Sudden onset of lump or bleeding inside the anorectum is the symptom which can be predict as a warning signs of the malignant transformation of the fistula. The diagnosing on the investigation is also tricky because the finding of cancer or normal fistula differentiating on the imaging usually difficult. We do CT scan to note that is there any extent beyond the anorectum, uh, or we do PET CT. If it is mucinous type, it can be even diagnosed on MRI. But there are limitations to get diagnosed exactly whether is it is a fistula or is had turned into a cancer is usually difficult. Gold standard to note to taking into OT, scrape out the discharge and send for diagnosis, and histopathology or pathological diagnosis will give a clear idea about is there any fistula or not. Usually in our practice, we do a colonoscopy in every fistula case if has not been done in last 5-10 years. The intent is it also help to diagnose the fistula associated colorectal cancer, it might be fistula associated, or it might be something inside which is going to be missed. Just we are treating the fistula. It's an our routine practice. We do colonoscopy in every case before proceeding for the fistula surgery. If it had been diagnosed with a fistula associated colorectal cancer based on imaging, based on symptom, or based on biopsy, the treatment is usually very tricky. What to be done? There is no very much clear cut guideline. Although outline is, if there is a fistula, we do a divergent stroma so that we can dry up the perineum or fistulous area. Once perineum is dried up, we can give chemotherapy or radiation or combined chemoradiation. Sometimes usually it is suffice, or some patient may need complete removal of anorectum, that is called APR surgery, to cure the fistula. The prognosis of fistula associated colorectal cancer remain uncertain. Sometimes low grade mucinous may have longer duration of survival even without any treatment, but sometimes squamous or poorly differentiated adenocarcinoma will have poor prognosis too. Thank you for watching. I hope this video added information about the fistula and fistula associated cancer to you. Although this video is not to mean to scare you, because this entity is very rare and very rarely seen by us, but I wanted to give the information so that you should be aware of it and you should get treated nearby colorectal surgeon. If anything you want to give the information, or you want a video about any kind of topic related with fistula, let us know. We can come with a new video in upcoming sessions. And don't forget to like, subscribe, share our videos to get updated about our upcoming videos on the colorectal surgeon channel. Thank you. Stay healthy and stay cured.